sunshine. It's our sunshine.
I am Dr. Sampurna Ghosh, ENT consultant of Sunshine Hospitals Gachibowli. Today's topic is about pediatric snoring and mouth breathing. It has been found from the data from different countries that about 10% of the preschool and school growing children are habitual snorer. Habitual snorer means a child who snores more than 3 nights per week. All the snorers are not a disease per se. There are some children who are innocent snorer or primary snorer. There are few who have actually the disease which is called obstructive sleep apnea. 2 to 3% of the total school going population has been found to be suffering from obstructive sleep apnea. Many a times this disease goes unnoticed both by the parents and by the pediatricians. The most important and primary feature is nasal obstruction, mouth breathing at night and snoring. There may be sleep disturbances, the child may not be comfortably sleep throughout the night, they keep on changing the position in the bed, they feel it difficult to lie down flat, sometimes they sleep on the abdomen, there can be bed wetting, there are many daytime features as well. Few children, they do suffer from attention deficit and hyperactivity syndrome as a sequelae of the nighttime sleep apnea. There are few kids who suffer from excessive sleepiness or drowsiness during the daytime. Mouth breathing has tremendous bad effect on a child's growth. The child may not be growing properly, not gain weight. There is a prominent features which changes the complete shape of the face. The face gradually becomes elongated, the tooth become crooked, there will be narrow and receded chin and narrow jaw. Many a times the dentist will refer to the ENT specialist before putting the braces to rule out the nasal obstruction and to treat the mouth breathing. The other long term consequences which is the most dreaded is damage in the lungs in form of pulmonary hypertension and cor pulmonale. Nowadays childhood obesity has increased a lot compared to the previous days, so which contributes to the sleep apnea. But the most common cause which we in everyday ENT practice I come across is the enlarged tonsil and adenoid. That is the commonest reason for childhood snoring and mouth breathing. As a parents, you have to understand that mouth breathing at no point of time should be considered normal. It is always pathological and it is trying to tell you that there is something wrong going in your child's body which has to be evaluated by the pediatrician and also by the ENT surgeon. We first do the clinical assessment, try to see what is the body weight of the child. If the BMI is more, we advise to reduce the weight. Then coming to the ear, nose, throat examination, we try to assess how big is the tonsil. There is grading system, is it grade 1, 2, 3 or 4, and then we try to do nasal endoscopy. There are children who cooperate after the age of 5-6 years. Normally we can do nasal endoscopy easily either with flexible scope or with pediatric rigid endoscope. That gives us a complete view of the nose, what is the septum, how are the turbinates, is the adenoid big or not. In case the child cannot cooperate this endoscopy procedure, we advise for X-ray nasopharynx to know the adenoid size, rarely CT scan of the nose. The treatment part consists of a multidisciplinary approach. If there is obesity, that has to be taken care of by the pediatrician, dietitian and endocrinologist. If there is big tonsil and adenoid, we should start medical management first. There are targeted medicine in form of nasal sprays, anti-allergic tablets or syrups which can be given for 2 to 3 months, and then we need to re-evaluate. If the child is improving with that, we can continue with medical management. If the medical management is not giving enough relief, it is rational to go for the surgery. The commonest surgery performed in kids for this problem is removal of the tonsil and the adenoid. Sometimes septoplasty or turbinoplasty, other endoscopic methods may be required to open up the nose. The ultimate aim is to allow the child to breathe through nose, stop the mouth breathing, and rescue from snoring or sleep apnea.
Sunshine, it's our sunshine.